What I didn't know, because I really couldn't, I was not in a place to understand it when Brian was going through this, was how much shame and stigma destroys people who are addicted. And I just learned just a couple years ago about a recent poll that said 80% of Americans in a recent survey said, I am unwilling to associate with someone addicted as my friend, my coworker, my neighbor, or marry into my family. Even though of those 80% that responded that way, 8 out of 10, most of them thought this was a chronic illness. It's not about whether this is poor character or chronic illness. This is about the public understanding that this is a treatable disease. Sure, as Stephan said, we can't give a vaccine and end it, but it is a treatable disease with success rates no different than diabetes, heart disease, or asthma. Same success rates. But it's not being implemented in our healthcare system. And because of that, of course, I wouldn't want someone who's addicted as my neighbor if he's not going to treatment, or he or she is going to treatment and they're going to treatment program that's not following the right things, and that person's not going to get better. So, in the answer to your question, I'm sorry I went on a little longer than maybe I should have, but after my son passed away, I looked at that and said, oh my God, something so tragic that we have information today that can start saving lives tomorrow, and it's not being used. But then I crossed out the word tragic and I put the word hope, because I could see it could be done. This was not about creating a vaccine. This was not about flying somebody to the moon. This was about taking existing research and blocking and tackling and getting it implemented.